So today I'm going to be demonstrating to you how to perform an acromioclavicular joint mode, an AC joint mode for short. So before we begin, let's go ahead and talk about what the AC joint itself is. So it's actually made up, if you look on the skeleton here, of two bones. So you have the clavicle and then the distal end of the clavicle, and then it's also made up of the acromion process on the scapula. And the two bones come together right in the middle there. That is the actual AC joint. It's also supported by two ligaments. You have on the top here your acromioclavicular ligament, and then on the inside you have your coracoclavicular ligament, and that's actually split up into two separate ligaments. So you have your conoid and your trapezius ligament. It's a synovial joint, and it's got a little bit of a meniscus in there. So the joint itself is actually vertically and horizontally stabilized in an anterior and a posterior translation by dynamic muscles. The deltoid, the upper trapezius are two major dynamic stabilizers of the AC joint, and the pec major assists in the stabilization a little bit. And it's also stabilized by some ligamentous structures. And this actually allows for normal anatomical range of motion of the joint itself. So because the scapula is such an integral part of our shoulder movement, we need to understand how the AC joint works within that movement. So during protraction, which is the shoulders coming forward, and retraction, like the shoulders going back, you actually have the scapula gliding in a horizontal, gliding horizontally underneath the tip of the clavicle. For example, like when you punch somebody. Let's go ahead and talk about upward rotation of the scapula. So like I demonstrated on the skeleton, so you are going to find the distal end of the clavicle, and then you're going to find the acromion process coming off of the scapula. You have your AC joint there. So when the scapula moves in an upward rotation, I'm going to go ahead and put my finger right on the distal end of the clavicle. The clavicle will elevate and posteriorly move out of the way during shoulder elevation. So if you notice my finger, it's going to move up, and it's ever so gently moving back behind her, leaving plenty of room to complete the full range of motion. Go ahead and come down. Perfect. If the AC joint is damaged and you're trying to complete shoulder range of motion, you will actually not be able to have full range of motion because the clavicle won't be able to move out of the way and the shoulder is going to get blocked. So there's a couple of typical ways that the AC joint can be damaged. One of the ways is having a direct blow to the clavicle itself by falling on an outstretched hand, also called a fouche. And that could possibly lead to a step-off injury. So it's going to be a little bit disconnected here, and that will actually cause the person to be hypermobile, and that will unfortunately end up putting them in the contraindication category of AC joint moves. And another thing that a person can have is thoracic outlet syndrome. One of the causes for thoracic outlet syndrome is basically immobility of the clavicle itself. So the clavicle is really stiff, it's not moving, and as you guys know, you need elevation and posterior motion of the clavicle during upper arm elevation to get full range of motion. So they will actually be hypomobile, so it would be a really good thing to do for somebody, AC joint moves, if they had hypomobility. And another thing that they can do is have impingement syndrome. So with impingement syndrome, we have an irritation and inflammation of the rotator cuff muscles, the main one being the supraspinatus. It runs through the subacromial space here and attaches right here. So with it being irritated and inflamed, when you're trying to do normal range of motion, it's actually going to get blocked, and that is going to inhibit the AC joint from properly fulfilling its job. So when performing joint mobilizations, we want to take a couple things into consideration. A few of those things being the person's age and their level of activity. For example, a young high school student who's on the wrestling team has a higher chance of being hypermobile. So you want to maybe look into alternative methods of improving range of motion than doing a joint mobilization. Unlike a 55-year-old male who has a day desk job, he will more likely be hypomobile and be more of a candidate for performing AC joint mobs on. And every time we perform an AC joint mob, we want to remember to clear contraindications. So always remember that hippos feel better having clean hair. Hypersensitivity, infection, excessive pain, open wounds, fractures, bone disease, hypermobility, cancer, and hematoma. So now I will be showing you one of 3 ways to perform this AC joint mob, and this particular way was shown to me by Erica Knoll, a physical therapist. Before we begin, always remember to clear your contraindications. So remember, hippo feels better having clean hair. So Chelsea, I'm just going to ask you a few questions that I ask of all of my patients to make sure we're appropriate for this treatment. Do you have hypersensitivity?
No.
Do you have an infection?
No.
Do you have excessive amount of pain?
No.
Do you have, or I actually see that you don't have an open wound. Do you have a fracture?
No.
Do you have, or have you been diagnosed with any kind of bone disease?
No.
Have you been told that you are hypermobile?
No.
Do you have cancer in the area, or have you ever had cancer?
No.
And I don't see any hematoma. Have you been told by a doctor that you have a hematoma?
No.
All right, perfect. We are good to go. So when you perform this joint mob, you're going to go ahead and start and palpate the SC joint, the sternoclavicular joint, and then you are just going to move down the clavicle until you find the acromion process right around that AC joint. So since there's not a lot to hang on to here, we're actually going to be moving the clavicle. And right here is a good time to go ahead and check for any kind of step off to make sure that there is no hypermobility in the area. And what you're going to do is you're just going to move medially on the clavicle about a distal a medial 1/3. My thumbs are going to go right underneath that clavicle, and then my top fingers are just going to help with the stability. And with AC joint mobs, you generally are going to always be performing a grade 3 and a grade 4. So I'm going to go ahead and move the clavicle into posterior motion, finding her end range. So my thumbs are just gently pushing in that posterior direction. Does that feel okay, Chelsea?
Mm-hmm.
And now I'm just going to go ahead and start performing my grade 3 in a posterior motion. And if I wanted a grade 4, just find that end range and that gentle vibration. And that's it. So with this joint mob, if she had muscle tightness, in particular the pectoralis major, what you could do prior to treatment is you could do a little soft tissue work on the pec major to loosen the muscle up, and that will allow you to get a little bit more clearance underneath that clavicle. Or you could simply just place a hot pack over that muscle and loosen up the area for a few minutes, and that'll just make the joint mob a little bit easier to do and more comfortable on the patient in general. So now I will be showing you my second method of performing an AC joint mob. This particular way was shown to me by Laura Safa, physical therapist assistant. So this will actually move the clavicle in an anterior direction. So what we're going to do is we're just going to go ahead and find the acromion process, and you're going to stabilize. You're going to find the clavicle and be at the distal end of the clavicle. Your thumb is going to go right behind it, kind of get a little bit underneath there, and then the front of your hand will kind of just be placed gently on top. So once you have stabilized the acromion process, you're going to go ahead and just gently push your thumb anteriorly gliding the clavicle anterior, and then gently start to perform a grade 3 or a grade 4 joint mobilization. So now I'll be demonstrating the third method to perform an AC joint mob. So this one will be mobilization with movement. So Chelsea will actually be abducting while I'm performing the joint mob. And this method was taught to me by Jessica Goodman, DPT. So what we're going to do is we're going to go ahead and stabilize her trunk. So I'm actually going to have my arm underneath and wrap around the back, and it's going to be underneath the scapula because you don't want to inhibit its motion. Chelsea, go ahead and make sure your thumb is pointing out, and then you are going to go ahead and just place your palm right over that clavicle. And then as Chelsea elevates her arm upward, I'm going to go ahead and be pushing the clavicle posteriorly, aiding in that motion. So go ahead and slowly start to move your arm up, Chelsea. And my arm just slowly starts to push it back. And Chelsea's going to want to move her arm up because that is the motion that we're performing. Thank you. References will be provided at the end of this video. Thank you for allowing me to show you how to perform AC joint mobs.